This is an instructional video on how to clean a subnasal lip lift incision. This wonderful volunteer is about 6 days out from a lip lift that we did under local anesthesia. Sometimes they can be done under local anesthesia or under sedation or in the operating room. She also had a laser around her eyes and a chemical peel, so you'll see some flaky skin. So I always tell patients this is a 3-step process to clean the lip lift incision. The first step we call the wet step, which you'll see in your instructions. So Eliana has a cup with hydrogen peroxide. You can take a Q-tip or you can take a 2x2 and get it wet and then gently dab the incisions. Go ahead. And what you're going to be doing is you're going to be cleaning these areas around the nostrils and underneath the incision. If there's some scabbing or a little bit of dry scab, you'll see kind of a white sizzle. You'll let that sit for a couple of seconds. Once it's done its thing, you can gently use your wet Q-tip to dry off or to flake away any dried blood. This patient's incision looks wonderful. The second step is the dry step. So you take a dry Q-tip and gently dab the incision. And you can also, if you don't have Q-tips or if there is more scabbing, you can also use a dry 2x2 to gently dab the incision. And then the third step is the ointment step. So on a Q-tip or on your gloves, you'll take a little bit of the Stratamed ointment or the vitamin A and D or the Aquaphor ointment, and you'll generously apply it along the entire incision. You want to be generous with the amount of ointment you apply to the incision, because the more moist that incision is with ointment, the better medium you have for a really nice incision and how it will look when it heals. So 3 steps: wet step, dry step, ointment step. You're doing that until your sutures come out, and once your sutures come out, what we'll show you in the next clip is steri strips that'll be along the incision. We like the patients to keep those on for 2 or 3 days, and once the steri strips fall off, you can start using our scar protocol. Once we've completed taking out the lip lift sutures, what we do in the office is we put some collodion glue on, which is kind of like a skin adhesive, and it sometimes can sting. And we put it, this is not something you'll be doing at home, but this is what we do in the office. We put a little bit of collodion glue on, and then we take these flesh-colored steri strips, and we apply it along the entire incision. And once I've covered her whole incision, we then put another layer of the skin adhesive over it. Now, depending on what other procedures you have done, these will stick really well or they won't stick at all because you have a lot of other things. Like this particular patient had a chemical peel, so she has some ointment on her upper lip and it doesn't stick as well, which is fine. If they fall off, that's okay too. If they don't fall off, I usually have patients take these tapes off at 2 or 3 days after they're applied and then start using the stuff for our scar protocol. So as you can see, the entire incision has been covered with steri strips, and then another layer of skin adhesive will go on in the office. And then I'll tell this wonderful volunteer, as soon as these start to fall off, she can start putting our scar protocol creams on there. If they haven't come off in 2 days, go ahead and take them off. You can use your tweezers at home or just gently lift the tapes off if they haven't fallen off after 2 or 3 days.